Stop believing that severe back pain after 50 automatically means your spine is wearing out beyond repair. Because what if the real reason your pain keeps getting worse has less to do with age and more to do with silent nutritional deficiencies that are literally starving your spinal discs, weakening your nerves, inflaming your joints, and accelerating degeneration from the inside out? What I'm about to share today could completely change the way you think about back pain, spinal stenosis, sciatica, disc degeneration, and even spine surgery itself. Because according to emerging research from some of the most respected orthopedic institutions in the world, many adults walking towards spinal surgery are doing so while deficient in critical vitamins their spine desperately needs to protect itself. And in thousands of documented cases, correcting those deficiencies dramatically improved pain, mobility, nerve health, muscle strength, and long-term spinal stability. Today, I'm going to walk you through the 5 most important vitamins every adult over 50 should understand before accepting the idea that surgery is their only option. I'm Dr. William Lee, and for more than 3 decades, I've studied the intersection between nutrition, inflammation, cellular repair, and degenerative disease. And what you are about to hear is not hype, alternative medicine, or internet folklore. This is evidence-based science published in peer-reviewed orthopedic and neurological journals around the world. The problem is not that the science doesn't exist. The problem is that almost nobody is connecting these findings directly to the aging spine in a way ordinary people can actually understand and use. Now, before we begin, I want you to do something important. Drop a comment below telling me your age and whether you deal with back pain, sciatica, spinal stenosis, herniated discs, or arthritis in the spine. I read every comment personally, and your experiences help shape future videos for this community. You are not alone in this journey, and the more openly we share information, the more empowered we all become. Today we are counting down from number 5 to number 1. 5 vitamins ranked from incredibly beneficial to absolutely essential for adults over 50 who want to protect their spine naturally, reduce inflammation, support nerve healing, strengthen spinal stability, and potentially slow the progression of degeneration before it reaches the point of surgical intervention. And I promise you this. The number 1 vitamin on this list is the one most people are deficient in without realizing it. It affects your discs, nerves, muscles, vertebrae, inflammation levels, and even the severity of pain signals traveling through your spinal cord. Stay with me until the end because that final vitamin may be the missing piece your spine has been waiting for. Let's begin with number 5. Number 5, vitamin C. Most people think vitamin C is only about immunity or preventing colds. But when it comes to spinal health, vitamin C is one of the most underestimated nutrients in the entire human body. Here's why. Your spinal discs are made largely from collagen. Those discs sitting between your vertebrae act like shock absorbers every time you stand, bend, twist, lift, or walk. Without healthy collagen, those discs gradually dry out, weaken, crack, and lose their ability to cushion the spine properly. And here is the critical detail most people never hear. Your body literally cannot build strong collagen without vitamin C. Vitamin C is a required cofactor in collagen synthesis. Without it, your body produces structurally weaker collagen fibers that are far more vulnerable to degeneration over time. Think of collagen like reinforced steel cables holding your spinal discs together. Vitamin C is the engineer overseeing the construction. Without enough vitamin C, the cables become thin, unstable, and fragile under pressure. Researchers studying adults over 50 found that lower vitamin C levels were strongly associated with more severe disc degeneration on MRI imaging. Even after adjusting for smoking, weight, and age, the connection remains significant. And biologically, that makes perfect sense. Over time, weak collagen means weaker discs. Weaker discs mean less spinal stability. Less stability creates more inflammation, more nerve compression, and more chronic pain. I remember speaking with a woman in her late 60s who had struggled with lumbar disc pain for years. Her diet was extremely low in fresh fruits and vegetables. When her nutritional status was evaluated, her vitamin C levels were profoundly low. After several months of improving her nutrition and using physician-supervised supplementation alongside physical therapy, her pain levels improved enough that her surgical consultation was postponed indefinitely. Now, I want to be clear. Vitamin C is not magic. It does not regrow destroyed discs overnight. But giving your spine the raw materials required to maintain collagen integrity is one of the most fundamental steps in supporting spinal health after 50. For practical guidance, aim for vitamin C-rich foods daily. Bell peppers, kiwi, strawberries, citrus fruits, broccoli, and Brussels sprouts are excellent options. Many adults also benefit from moderate supplementation under medical supervision. And here's something else important. Vitamin C works especially well when combined with protein-rich foods containing glycine and proline because those amino acids are the actual building blocks your body uses to construct collagen fibers. Now, as important as collagen support is, structural damage alone is not what creates severe suffering in most spinal conditions. The pain that destroys sleep, limits walking, and drains quality of life usually comes from irritated nerves. And that brings us to number 4. Number 4, vitamin B12. If you have numbness, tingling, burning pain, weakness in your legs, balance problems, or sciatica symptoms, this section may be one of the most important things you hear today. Vitamin B12 is essential for nerve health. Not optional, essential. Every nerve in your body is wrapped in a protective coating called myelin. Think of myelin like insulation around electrical wires. Without healthy insulation, electrical signals become distorted, weak, chaotic, or painful. That is exactly what happens in B12 deficiency. When B12 levels drop too low, nerves become vulnerable to damage and inflammation. Pain signals intensify, tingling increases, weakness progresses, balance deteriorates. And here is where it becomes directly relevant to spinal problems. When spinal nerves are already compressed by stenosis, herniated discs, arthritis, or inflammation, B12 deficiency makes those nerves far less resilient. In other words, the same degree of compression may feel dramatically worse in someone whose nervous system is nutritionally compromised. Researchers examining patients preparing for spinal surgery found remarkably high rates of suboptimal B12 levels. And patients whose deficiencies were corrected often experienced better nerve recovery and improved post-treatment outcomes. One retired postal worker I spoke with had severe radiating pain and weakness down one leg. He assumed surgery was inevitable, but his blood work revealed significant B12 deficiency, likely related to age-related absorption problems combined with a largely plant-based diet. After supervised methylcobalamin supplementation and targeted nutritional changes, his nerve symptoms improved dramatically over several months. Again, this does not mean everyone can avoid surgery, but supporting nerve health biologically matters enormously. Here's another important point many adults over 60 don't realize. As we age, stomach acid production declines. That makes B12 absorption much harder even when people think they're eating properly. Certain medications, including acid blockers and diabetes medications like metformin, can worsen the issue even further. This is why older adults are at particularly high risk for silent B12 deficiency. If you have persistent fatigue, memory problems, numbness, burning feet, sciatica-like symptoms, weakness, or balance issues, ask your physician about testing your B12 status. And when supplementing, many experts prefer methylcobalamin because it is the neurologically active form of B12. Now, nerve irritation is only one part of the degeneration process. There's another invisible force accelerating spinal breakdown year after year, and most people never think about it. Oxidative stress, and that brings us to number 3. Number 3, vitamin E. Inside your spinal discs, cells are constantly exposed to wear, compression, reduced oxygen delivery, and inflammatory stress. Over time, those cells become damaged by unstable molecules called free radicals. This process is known as oxidative stress. Think of oxidative stress like rust slowly forming on metal. The structure doesn't collapse immediately. Instead, damage accumulates silently over years until the integrity weakens enough for symptoms to appear. That is exactly what happens in aging spinal discs. Vitamin E, especially the tocotrienol forms, acts as one of the body's most powerful fat-soluble antioxidants. It helps protect spinal disc cells from oxidative damage and inflammatory deterioration. Researchers studying adults with degenerative spinal conditions found that antioxidant support may help reduce some of the cellular stress associated with disc degeneration. And here's what makes this especially important for older adults. Spinal discs receive very limited blood flow naturally. That means nutrients arrive slowly and damaged tissue heals poorly. Protecting those cells from additional oxidative injury becomes critically important. I once spoke with a retired teacher who had progressive lumbar degeneration visible across multiple MRIs over several years. Her diet contained almost no healthy fats, nuts, or seeds. After improving her nutrition and introducing antioxidant support alongside lifestyle changes, her symptoms stabilized significantly and her imaging progression slowed dramatically over time. One of the most powerful words in medicine is not cured. It's stable, because when degeneration stops accelerating, people regain hope. They regain function. They regain independence. For practical support, vitamin E-rich foods include almonds, sunflower seeds, hazelnuts, avocado, spinach, and olive oil. And remember this, Antioxidants do not erase decades of damage, but they may help reduce the inflammatory environment driving further degeneration. Now we move into the final 2 vitamins on this list. And these next 2 are so critically important for adults over 50 that I genuinely believe many people are suffering unnecessarily simply because nobody ever explained their role properly. Number 2 completely changes how calcium behaves inside the body, and almost nobody talks about it. Number 2, vitamin K2. Most people assume calcium automatically goes where it belongs. It doesn't. Without the proper biological signals, calcium can end up deposited in the wrong places entirely. That is where vitamin K2 becomes incredibly important. Vitamin K2 activates proteins responsible for directing calcium into bones while helping prevent calcium accumulation in soft tissues. Why does that matter for your spine? Because one overlooked contributor to spinal stiffness and stenosis is abnormal calcification of soft tissues around the spine. Ligaments that should remain flexible gradually become thicker, harder, and less elastic over time. As this happens, they can crowd the spinal canal and contribute to nerve compression. Vitamin K2 helps regulate this entire process. Think of vitamin K2 as traffic control for calcium. Without proper traffic control, calcium gets deposited chaotically. With proper regulation, calcium is more effectively directed towards strengthening vertebral bone instead of accumulating where it causes harm. Research examining adults with calcification-related spinal conditions found strong associations between lower K2 status and more advanced tissue calcification. And here's another major reason K2 matters after 50: bone health. Your vertebrae must remain strong enough to support body weight, movement, balance, and structural alignment. Weak vertebrae increase the risk of fractures, instability, posture changes, and chronic pain. Vitamin K2 works closely with vitamin D3 to help maintain healthy bone metabolism. And this partnership is absolutely critical. Vitamin D helps your body absorb calcium. Vitamin K2 helps direct that calcium properly. Without K2, increasing calcium absorption alone may not fully support healthy tissue distribution. That is why many experts recommend taking vitamin D3 together with K2 rather than separately. One former firefighter I heard from had severe walking limitations due to spinal stenosis and ligament thickening. After comprehensive nutritional intervention, including physician-supervised K2 support alongside mobility therapy and anti-inflammatory strategies, his walking tolerance improved substantially over time. Again, not perfection. Progress changes lives. Foods naturally rich in K2 include natto, egg yolks, certain cheeses, grass-fed dairy, and fermented foods. Some adults may also benefit from supplementation under physician guidance. Now we arrive at number 1, the vitamin that influences nearly every major structure involved in spinal degeneration, inflammation, muscle weakness, chronic pain, nerve irritation, and bone loss. And the deficiency rates are staggering. Number 1, vitamin D3. Vitamin D3 is not just a vitamin. Biologically, it behaves more like a hormone, and its influence on spinal health is extraordinary. Researchers examining patients preparing for spinal surgery found shockingly high rates of vitamin D deficiency. In some studies, more than half of patients showed inadequate levels before surgery even began. Why does this matter so much? Because vitamin D3 affects the spine through multiple major pathways simultaneously. First, bone density. Without sufficient vitamin D, your body absorbs calcium poorly. That weakens vertebral integrity over time and increases the risk of fractures and degeneration. Second, muscle function. The muscles surrounding your spine are your body's natural support system. Weak muscles place greater mechanical stress directly onto discs, joints, and ligaments. Low vitamin D is strongly associated with muscle weakness, instability, and impaired physical function in older adults. Third, inflammation. Vitamin D helps regulate inflammatory signaling throughout the body. When levels are low, inflammatory pathways can become overactive, amplifying pain sensitivity and worsening nerve irritation. Fourth, nerve health. Vitamin D receptors exist throughout the nervous system. Deficiency has been linked to increased neuropathic pain, heightened pain sensitivity, and reduced nerve resilience. This means 2 people with similar MRI findings may experience completely different pain levels, depending partly on their vitamin D status and inflammatory environment. I remember hearing from a retired grandmother in her early 70s who had spent years struggling with low back pain and bilateral sciatica symptoms. She had tried injections, medications, and physical therapy with limited success. When her vitamin D levels were tested, they were profoundly deficient. After several months of medically supervised correction alongside strengthening exercises and nutritional changes, her pain scores improved dramatically. She started walking longer distances again. She returned to gardening. She began spending time outdoors with her grandchildren without fear dominating every movement. And that is what this conversation is really about. Not vanity, not miracle cures, not false promises. Function, independence, mobility, confidence, the ability to move through your life with less pain and greater freedom. Now, I need to say something very important. Vitamin D3 is not a replacement for necessary surgery. Severe spinal cord compression, progressive neurological deficits, instability, and certain structural emergencies absolutely require appropriate medical care. But the scientific evidence strongly suggests that many adults are attempting to manage spinal degeneration while profoundly deficient in nutrients their body requires for repair, stability, inflammation control, muscle support, and nerve resilience. That matters enormously. For practical guidance, ask your physician to test your 25-hydroxyvitamin D level. Many experts consider levels between 50 and 70 nanograms per milliliter supportive for musculoskeletal health, though individual needs vary, and supplementation should always be medically supervised. Vitamin D3 is best absorbed with meals containing healthy fats, and many specialists recommend pairing it with vitamin K2 and magnesium for optimal utilization. Magnesium is especially important because your body needs it to activate vitamin D properly. Unfortunately, magnesium deficiency is also extremely common in older adults. Excellent magnesium-rich foods include pumpkin seeds, almonds, spinach, black beans, and dark leafy greens. Now, before we close, I want you to understand something deeply important. The story most people hear about the aging spine is incomplete. They are told degeneration is inevitable. Pain is inevitable. Weakness is inevitable. Loss of mobility is inevitable. And surgery is simply the unavoidable destination waiting at the end of the road. But the research tells a more hopeful story than that. It tells the story of a body that still retains remarkable capacity for adaptation, repair, stabilization, and response when given the biological environment it needs to function properly. Your spine is not just bones stacked on top of each other. It is living tissue, living discs, living nerves, living muscles, living bone, living inflammatory systems constantly responding to the signals you provide through nutrition, movement, sleep, stress management, and overall health. That does not mean aging stops. It means decline is not always as inevitable or as irreversible as people assume. And that distinction matters, because hope changes behavior. When people believe improvement is possible, they move differently. They eat differently. They engage with treatment differently. They reclaim agency over their health instead of surrendering to fear. And often, that shift alone becomes the beginning of transformation. If you found this information valuable, I want you to do 3 things. First, subscribe to the channel and turn on notifications because every week we break down evidence-based health information specifically for adults over 50 in plain, understandable language. Second, share this video with someone dealing with chronic back pain, sciatica, spinal stenosis, or degenerative disc disease. This information may help them ask better questions and make more informed decisions about their health. And third, leave a comment below telling me your age and which of these vitamins surprised you most today. I read every comment personally, and hearing your stories helps build this incredible community of people committed to aging with strength, dignity, and knowledge. Because you are not powerless in the story of your spine. Not now, not after 50, not after 60, not after 70. The science says your body still has the capacity to respond, and I believe that completely.